Psoriasis is an autoimmune skin condition. In this, the skin cells multiply 10 times more than the usual and they doesn't fall off. Instead of falling off, they pile up on each other, causing thick lesions. Psoriasis is usually classified into 6 types: plaque psoriasis, guttate psoriasis, inverse psoriasis, pustular psoriasis, erythrodermic psoriasis, and nail psoriasis. In this, the most common type is plaque psoriasis. About 80 to 90% of people suffering with psoriasis has plaque psoriasis. In this, there are thick scaly patches called plaque. This commonly appears on the scalp, elbow, back and knees. In severe cases, can affect the entire body. In most cases, it first appears on the scalp and the person affected with it confuses it for dandruff and takes anti-dandruff treatments, which again triggers the psoriasis. Typically, new cells grow every 28 to 30 days. But here, the new cells grow and move to the surface of the skin within 3 to 4 days, causing thick plaques. The plaques are invariably symmetrical, that is, will be found on both sides of the body, but the number of plaques may vary. Here, the plaques are silvery white in color and on removing you can see pinpoint bleeding spots. The second one is guttate psoriasis. It is classically triggered by bacterial infection, strongly associated with a streptococcal infection. This typically occurs 1 to 2 weeks after an episode of tonsillitis. Here the lesions are small red tear-shaped scales and it often affects children and young adults. The third one is inverse psoriasis. It is present in the skin folds of buttocks, breast and groin area. Here there are thin plaques without scales. The next is pustular psoriasis. It is a very rare type. Here you can see a clearly defined pus-filled blisters. It can occur in widespread patches or in small areas of palm or sole. Fifth one is erythrodermic psoriasis. It is a least common type of psoriasis. It can cover the entire body, almost 90% of the whole body. Here the rashes will be peeling with intense itching and pain or burning sensation. Last one is nail psoriasis. It causes discoloration, changes and pitting in the nails of toe or finger. The commonest doubt about psoriasis is that will it spread? Psoriasis is not contagious. It doesn't spread from the rashes to the next person, but it has a strong genetic trigger and a hereditary factor. Now let's see how Ayurveda views psoriasis. In Ayurveda, psoriasis comes under a group of skin diseases called kushta. It is caused due to the vitiation of the 3 doshas, Vata, Pitta and Kapha. Kushta is classified into 18 types according to the dosha predominance. The plaque psoriasis can be related to Sitma Kushta, which is Vata Kapha predominant, and the pustular psoriasis can be related to Audumbara Kushta, which is of Pitta predominance. The main causative factors for Kushta are Nitya Ahara Vihara. That means improper diet and regimen. In diet, the main culprit is Viruddha Ahara. Viruddha Ahara are the incompatible food combinations. There are many food items which when processed in a wrong way or combined with wrong food items causes a poisonous effect in the body. This produces Agnimandia, which results in formation of ama or toxins, which in turn vitiates all the 3 doshas and recta, resulting in kushta. And one important thing to be noted in kushta is about the vihara or the regimens we do. It's not only the wrongdoings which we do in this life, but also purva janma krita paba, that is the sins which we have committed in the previous life is also cited as a reason for psoriasis or kushta. Ayurvedic treatment protocol for psoriasis. Psoriasis being a deep-seated chronic autoimmune condition, it requires repeated shodhana karma, that is purification processes. Snehapana followed by shodhana karma is the best treatment protocol for psoriasis. The panchakarma or shodhana karma which is to be done is selected according to the predominance of the dosha. The kushta, if it is of kapha predominance and mostly present in the upper area, then we go for vamana. If it is of pitta predominance and is present in the lower part of the body, then virejana is a better option. Usually vasti is contraindicated in psoriasis, but there are some specific vastis which give very good results in this condition. The last panchakarma, nasya, is also very helpful in treating psoriasis, especially the scalp psoriasis. As I told earlier, repeated shodhana is very important in psoriasis to prevent its further recurrence. Vamana is said to be done in 15 days, Virejana once in a month, and Nasya once in every 3 days. And Rakta Moksha is said to be done in 6 months. The type of shodhana to be done depends on the dosha predominance. Rakta Moksha and Virejana is usually done in Pitta predominant conditions. So, the most important treatment in psoriasis is Shodhana Chikitsa or Panchakarma, which is to be done after Snehapana. Snehapana might not be possible in all the cases. So, first we have to make the Agni and Bala of the patient strong enough to withstand the Snehapana procedure. For that, the best treatment is Takrapana. So, how we start the treatment is, first, we improve the Agni or digestion of the patient. For this, internal medicines which improves the digestion and corrects metabolism are given. Along with that, a procedure called Takrapana is done both internally and externally. Takrapana is nothing but drinking of buttermilk, medicated buttermilk. Up to 1 to 2 liters of buttermilk is made to drink in a day. And externally, we do dhara with the buttermilk. After this, once a patient's Agni becomes very strong, we go to the second procedure called Snehapana. Here, medicated ghee or oil according to the condition and dosha predominance is selected and given to the patient. First, we will start with a small dose, say 20 ml or 25 ml, and slowly in each day we will be increasing the quantity of sneha which is to be given till the patient shows complete saturation of the body with this ghee or oil. Usually on an average it takes 7 days. Once the body is fully saturated with the ghee or oil, we go for the Shodhana Chikitsa. The importance of Snehapana is that this Sneha, it goes deep inside the body into each and every cell and it mixes with the toxins and it makes it easy to take it out from the body by doing Shodhana. So the next Shodhana Karma or Pancha Karma, which one to be done is selected according to the dosha predominance. Vamana or Virejana, any one of this treatment protocol will be done. Mostly, Vamana or Virejana is done according to the dosha predominance. Once the cleansing procedure is over, then we go to the Patya Krama or Samsarjana Krama. It is a specific set of diet that is to be followed after Panchakarma. This will go on for 5 to 7 days. After this stage, we will start with Shamana Aushadis or internal medicines that is to be given to pacify the remaining doshas left inside the body. Along with this, external treatments like different kinds of application of paste, dhara, etc. can also be done to remove whatever remnants are left in the body. So these Panchakarma or Shodhana treatments has to be done repeatedly as I have said before. Other than this, Adravya Chikitsa or Deva Vyapashraya Chikitsa is said to be done in Kushta. Since there is an involvement of mind, along with this, Adravya Chikitsa is also said to be done. These are some good practices to be followed to keep the mind pure and stress-free. So, to prevent further recurrence, always keep a happy mind devoid of stress. Avoid Viruddha Ahara. Do pranayama and asanas regularly to keep a healthy mind and body.